Fine. So, so today we are going to discuss with some of the important medications, okay? So that are really needed for NCLEX. I know medications are one of the hardest part in the NCLEX exam, isn't it? So like in the sense, like you are really confused with so many medications. We have so many medications, and we may really forget like what are the side effects as well as what are the important nursing interventions, but trust me, you don't need to worry so much. Why? Because like they know, like NCSBN definitely knows that. So learning all medications are really hard, but still some of the medications which are very commonly used in practice, okay? So it could be mainly antihypertensives, diuretics, and opioids, okay? So NSAIDs, antacids, and of course psychiatric medications. So these are some of the important ones, very important ones, okay? Amanda says that she can't hear me. Is it the problem only with Amanda? Are others able to hear?
Yes,
Yes.
ma'am.
Yes. Okay,
Yes,
Amanda,
ma'am.
could be problem with your device. Please log in once again. Oh, she's not able to hear. Then what's the use if I speak? I'll just type her. Uh, okay. So to begin with, I would like to focus some of the important drugs and what are the important nursing interventions. Okay, so I would be making sure that it would get the slides that are going to present today would be uploaded in your resources, under your resources. So by next week. Okay, so by next week it would be uploaded. So no need to take a screenshot and save, or if you wish you can, but I request you to write down the main points, because what you write on or your lecture notes are very important, isn't it? So therefore you can write down those ones which are very, I mean, so the ones that I highlight in the class, the points, so you can just focus on those points. Okay, yeah. So let me start sharing my screen. So to begin, we need to, you need to know the basics of medicine administration. So sorry, this administration spelling is wrong. So now I'm recognizing this. So, okay, so sorry for that. So TRATION. So the basics of medicine administration in the sense, have a complete order of medications. So that's very important. Okay, so you need to check allergies, mainly latex allergy, food, any allergy to contrast media. Assessment always before administering any medication. Assess your client. That's very important. Okay, other than the symptoms what he is experiencing, so for which you are giving the medications, other than that, so is he having any gross like allergy to previously given or when the same medication was previously given to him? Okay, and even after giving the medication, so you will have to assess your client whether he is fine or not. Okay, so that's the next important aspect. Moving to the next one, notify your physician and clarify if there is any questionable order. For example, like certain drugs that are in, for example, digoxin. Okay, so you know digoxin should not be given. So if the heart rate is below 60, isn't it? So digoxin should be held. So sometimes the client would have been, the doctor would have prescribed digoxin. The next day it would be due for administering digoxin, and you know that your client's heart rate is 58. So you can't just close and you can't just blindly administer. Okay, so you will have to, that comes under medication error. You will have to definitely notify the physician that the client's heart rate is 58. Do you have to continue or not? You have to clarify. Okay, so make sure about the 6 routes of medication. So that is right patient, right dose, right medicine, right time, right route, and right documentation. Okay, so never use unlabeled medicine. the medicine which is not labeled, never use. Discard any partially used single dose containers. If you find the container is half, okay, so discard, don't use it. Okay, label the multi-dose vials with date, time, initial and expiration date. So all these are the basics of medicine administration. Coming to few terminologies related to medication administration. One is therapeutic level. What do you understand by therapeutic level? Therapeutic level is the level through which we know that, so at this level, the medication is found to be effective. Okay, so that is called as therapeutic level. I will be showing you a screen of certain therapeutic levels later at the end of the session. So like in the sense, like especially when heparin is given, okay, we say that, so when the heparin is like, I mean, so if it has to be effective, so the heparin's value should be 1.5 the greater than the normal ones, isn't it? So the APTT and also should be 1.5 times greater than the normal range. So that is what we can call it as therapeutic level. So which indicates that the medicine is effective at this level. Okay, so is that clear? So now this is very important. It applies mainly for digoxin, heparin, vancomycin, theophylline. Okay, so there are many drugs like that. Fine. Okay, so for example, if the APTT level is between 21 to 35, so this is the normal range of APTT when medicine is not there or when heparin is not administered. Okay, so now in that case, now when heparin is being administered, so you can, the range can go, the APTT can go 1.5 times higher than the base value, which means that it can go up to 70. Okay, so but greater than 90 can be considered as non-effective. So that is the therapeutic range we say. Hope you are understanding. Okay, so what is therapeutic index? Therapeutic index is peak and trough. Trough in the sense, what do you understand? The minimum level or the minimum range that the or the minimum range of medicine, so that is found, or the minimum therapeutic level is something we can call it as trough. Okay, so before you give the next dose of medicine, so you need to check so whether the medicine has reached its minimum therapeutic level or not. Okay, so and also the peak also should be noted. What is half-life? Half-life in the sense, sometimes certain medications like enoxaparin, for example, so heparin, enoxaparin has got the same, I mean, so the indications are the same. So whereas the half-life period of enoxaparin is I mean, so when we consider this, we say that the enoxaparin and heparin. Okay, so what is the difference basically? So do you have any idea? So enoxaparin, what is, I mean, so this is basically an anti I mean, so it comes under the low molecular weight, isn't it? So therefore, so when we talk about the half-life of enoxaparin, so what do you know about it? Any idea? So half-life is at, like, for example, if the heparin stays for like, I mean, so around 12 hours, okay, so then enoxaparin, so how many hours does it stay? So that is something. Okay, so you need to know that is around 4.5 hours. The dose, after that the medication will be removed from the body. Okay, so that is what we can call it as half-life. Okay, so anyways, that's just for your understanding. So let us focus on to some of the important points associated with the different drugs. Okay, so when it is given. So when oral drugs are administered, in the sense when drugs are administered through orally, don't give with vomiting, no gag reflex. If the client has swallowing difficulty or decreased level of consciousness, you are not supposed to administer the drug. Okay, oral can be given with food or without food, but before oral medications are crushed, cut or diluted, you need to check with the physician whether that is okay or not. Okay, yeah, so it is best to give in an empty stomach 1 hour before or 2 hours after the meal, and the position is usually upright or Fowler's position. Okay, so that is the position that is usually given for administering oral medications. Transdermal. Transdermal in the sense, like it is given in the form of patches, isn't it? So that is transdermal. When any transdermal patches are applied, the area should be very clean and dry. Okay. And suppose if there was any patch that was applied previously and you are going to change the patch, so make sure that the patch is removed and it is properly cleaned and dried before applying the next patch. You need to use gloves for applying transdermal patches. So normal gloves, clean gloves is enough, but gloves is mandatory. Okay, and only it should be placed on hairless area to be more effective. Okay. Yeah. Coming to the drops. Drops in the sense are instilled into the eye as well as ear. Okay. And here, like you need to, you can usually use anti-aseptic techniques. Pinna should be up and back for adults and down and back for kids when instilling ear drops. Side lying position. And the client should, in the sense after administering the medication, okay, so make sure that he doesn't blow for some time. Fine. So when instilling medication into the eyes, it should be instilled into the conjunctival sac. Okay. Yeah. Coming to the medicine administration through GT, gastrostomy tube or nasogastric tube, first and foremost, before you start giving the medication, the tube placement should be checked. Only liquid forms are permitted. Okay. And of course, you need to check certain drugs cannot be, usually medicines have to be administered separately. It is best not to mix with any feedings. Okay. So it should be given separately. Fine. After the medicine administration, make sure that you flush the tube, okay, because the deposits can be so it can stick to the tube and therefore it should be properly cleaned. So therefore you will have to flush it. Okay. Yeah. So coming to the IV, IM or subcutaneous, vastus lateralis is the route that is acceptable for children below 2 years. Okay. And that's very important, below 2 years. Okay. So now older children above 2 years, you can select the IM and all. So because why vastus lateralis, why not gluteal? Any answer? Why not gluteal? What happens? Why not
Because
gluteal?
not developed more muscles in the tail.
Yes, exactly. They are not developed properly. Okay. So that's why. So you are not supposed to administer gluteal in the gluteal area. Okay. Yeah. So coming to the next, the remaining aspects. It can be needle size, syringe has to be noted properly, and you will have to always rotate the injection area. Fine. Discard all sharps, monitor for side effects immediately. And as we already discussed, ventral gluteal area should be considered only after 2 years. Okay. So these are some basic aspects in regard to the common medication administration. Moving to the common IV complications when intravenous medications are administered, So infiltration, extravasation, hematoma, and phlebitis. So these are the common complications, IV complications. Okay. So infiltration, extravasation, you know that. What do you understand by extravasation? Mainly chemotherapeutic drugs and all. The main side effect is extravasation. What happens there? So what happens when there is extravasation? How do you identify extravasation? Yes. So swelling will be there, isn't it? So that, which means that it has not inside the vein, rather it has been secreted in and around the tissues in the skin. Okay. So where the skin becomes red, swelling, and that will end up in burning too. Fine. Okay. So infiltration in the sense, what do you understand? Infiltration. Yes. The IV infiltration in the sense, what idea do you have? Infiltration.
The skin becomes tightened and cool, gets
Okay.
swollen. Yeah,
Swollen. No,
it
actually, what's happening there? What's happening there in infiltration?
The fluid gets into the the fluid gets out from the vein into the body tissues and the skin gets swollen.
Okay, so fine. But then what is the difference between extravasation? Extravasation.
In infiltration, the
fluid.
skin there's no tissue damage, but in extravasation there is tissue damage.
Tissue damage, exactly.
Due to the harshness of the
Yes, exactly. Okay, so which means that it can really, extravasation ends up or causing damage to the cells, the tissues, and therefore the skin will be hard. Okay, and you will find lots of so the client will experience too much of pain in the case of extravasation. Okay, even ulcers can happen. The tissue death can result because of extravasation. Okay, so infiltration is only the leakage that you generally find so after administering the IV medications. Okay, so infiltration and extravasation are the common condition. Infiltration is very common complication that you can generally see, and wherein extravasation is usually happens mainly in chemotherapeutic drugs and all. Okay, apart from that, hematoma, phlebitis. Okay, so now here when infiltration occurs, you can stop infusion and encourage range of motion exercise. Cold or warm compresses can be started. Okay, and also you can check for any new site, so you will have to restart in a new site. Okay, yeah, so usually when there is extravasation, you need to stop and immediately notify the MD. So depending upon the client's status and all, the protocol differs, and therefore you will have to notify the MD immediately. Okay, yeah. So and of course, if there is hematoma, so make sure that you apply some warm compress. Okay, so you apply some warm compress. Okay, so there is a mic is on in the background. Linimore, please mute your mic. Okay, fine. So moving to the next one, phlebitis. So usually we can go for cold compress. Okay, so that's usually helpful there. Okay, so usually if there is phlebitis, we can go first, we can provide cold compress, then warm compress. Okay, so that is usually done. So if there is phlebitis, you need to, the cold compress is usually applied to stop the blood flow. Okay, and then warm compress will help in improving the circulation. So these are the aspects or the main complications associated with the IV medications. Okay, yeah. So let us focus on the common side effects because of medications in different systems, especially. Okay, CNS, if any drugs are, so especially CNS stimulants and all, so you will have to provide seizure precautions. Okay, if you provide CNS depressants, then driving or any hazardous activities should be stopped. Okay, when specifically providing CNS drugs, like Parkinson's and all, you need to antipsychotics and all, you need to check for extrapyramidal symptoms. Okay, so extrapyramidal symptoms wherein there could be usually most of the drugs that will bring changes in the central nervous system, the EPS is very common, antipsychotics, Parkinson's, anti-Parkinson's drugs and all. Okay, so focus on these aspects. What about the anticholinergic property? Anticholinergic drugs I usually say in the class all the time, isn't it? So anticholinergic, the dry mouth is a very common side effect. You need to make sure that your client sips fluids very often. If there is photophobia, so most of the anticholinergic drugs are photophobic. So let your client wear sunglasses, and also urinary, because since it has got drying effect, so urinary retention is also common. Monitor intake and output when anticholinergics are administered. Okay, yeah. So cardiovascular drugs usually when antihypertensives are given, orthostatic hypotension is the common side effect. Orthostatic hypotension is the common side effects. You need to change the positions very slowly. Okay, so that's very important. Fine. So and also GI drugs, basically vomiting. It will act on the vomiting center, and of course when NSAIDs and all are given, so note for whether the client is experiencing any bleeding. Bleeding can usually be evidenced as overt bleeding and occult bleeding. Overt bleeding wherein the blood is visible in the feces, in the stools, whereas in occult bleeding, blood is not visible. Okay, so you will have to go in for the lab values, so that will show decreased hemoglobin, hematocrit and all. Okay, and when usually hematological drugs are mainly anticoagulants and all, so check for bleeding. So that's very important. The common side effects of bleeding are petechiae, purpura. Okay, so isn't it? So the bluish, purplish, the purplish brownish spots on the body, petechiae, purpura, what do they indicate? The client has got some problems in clotting. So these are the common ones that you need to know. Fine. Okay. Yeah. So now, so these were the very basic aspects in general that you need to know. Apart from that, see, you need to understand that usually most drugs are hepatotoxic, nephrotoxic. Okay, they can usually be causing allergy, and sometimes it can also it can suppress the immune system. Okay, so may I know if drugs are hepatotoxic, so what are you supposed to check in them? If, for example, if you are administering isoniazid and all, so what are you supposed to check in them?
The liver enzymes.
Liver function test.
The liver enzymes.
Yeah, exactly.
That's
The liver
ALT
function
and
test, isn't it? Okay, so before starting these drugs, remember, so before starting these drugs, you will have to check for the liver function test. So that's important. Okay, and what signs you will have to observe after the client is initiated with the hepatotoxic drugs?
Vomiting.
Nausea, vomiting, very good. Okay, then anorexia, and most importantly, jaundice. Okay, so jaundice. So these are the signs and symptoms you should be checking for. Coming to the nephrotoxic drugs, usually NSAIDs and certain antibiotic, antimicrobial drugs are nephrotoxic, mainly like aminoglycosides and all. So, and what do? You have to check if before administering the nephrotoxic drugs. What are you supposed to check?
Kidney
the
function test.
keratin and
RFT.
the keratin and the BUN.
Yes,
That's
exactly.
the kidney function test.
Yes, exactly. Okay. So now kidney function test. So as the BUN, the creatinine levels and all should actually be checked. Okay. So they are the other important aspect under the nephrotoxic drugs. Fine. Okay. So suppose if you give any drugs, like, I mean, so certain drugs for if any drugs cause allergic reactions. Okay, so what are you supposed to do? Like, for example, blood transfusion, before initiating blood transfusion and all, so what are you supposed to assess for? You can give your clients with antihistamines. Okay,
And check ma'am respiratory system as well.
check the respiratory system. So what is the drug of choice for anaphylactic reactions? Epinephrine. Okay, so
Epinephrine.
Yes, what is the root? Epinephrine. Root of epinephrine, adrenaline.
Subcute.
IV.
Subcutaneous. Subcute.
Sub-Q, or even IM is given, not IV. Okay, so
IM,
even
ma'am.
IM is given. Yeah, IM is given. Okay, yeah. So IM is the main route that you need to know. Yeah, it can also be given sub-Q, but usually not IV. Fine. Okay, so then, yeah, so these are the common systemic effects that you will have to know. Fine. So moving on to next, I would like to discuss some of the commonly used drugs under each category. Under each category, in the sense, under each important category, I can say, because I'm not going to bring in all the drugs here, because we know there are drugs in the sense so many, isn't it? Like we have thyroid drugs, anti-thyroid drugs, thyroid hormones are there, anti-Parkinson's are there. So for each and every problem, we are having numerous drugs. So, but however, the most important ones that are usually asked for NCLEX. So the points associated with that would be discussed. Okay. Yeah. So the first part is some of the drugs that are usually used for cardiac arrest, anaphylaxis, and shock. I'm going to discuss about these drugs. Okay. So norepinephrine, dopamine, and of course epinephrine, isoproterenol. So these are the commonly used drugs. Okay. Now, so when these norepinephrine, let us go one after the other. Only the main points you need to know, not everything. Okay. So norepinephrine, when it is given, the common side effect is headache, because so this is actually going to increase the blood pressure. And you know, the common side effect for increased blood pressure is hypertension, isn't it? So therefore, headache is the common side effect. What about reflex bradycardia? What do you understand by that? Reflex bradycardia. Yes? Any idea? Reflex bradycardia? What is meant by that?
Counteraction.
Like how the client is
Compensate.
going to, or what the client is going to experience here. Yes. So reflex bradycardia in the sense, so when these drugs are given, so the body adjusts to a certain state that the body doesn't become, in the sense like when norepinephrine and all is given, you know, so the body responds to make sure that the homeostasis is not affected. Okay, the way the body responds to very high elevation in blood pressure is called as reflex mechanisms, or whatever it is the problem. Okay, so now reflex bradycardia is because of the excess, because there is going to be vasoconstriction here. Okay, and that's why the increased BP has to happen. I mean, so like there is increased blood pressure. Now, in order to make sure that the body or the body shape doesn't become too or the side effects does not occur, in order to prevent that, the reflex bradycardia happens. Okay, so wherein the myocardium, I mean, so there are some changes in the afterload, preload, and all, so that will be bringing or the cardiac output and all, it will greatly affect, and the heart rate reduces. Okay, so to make sure that the body's homeostasis is not getting affected because of the high because of the increase in the blood pressure. Okay, yeah, so you need to know this. So this drug is, that's one thing, one important point. So of course it has to be given only with dextrose solution, or usually isotonic saline, and with dextrose it can be. Isotonic solutions are also used here. Usually very commonly dextrose solution it is infused, because apart from dextrose, if any other solutions are given, it doesn't become compatible with that, in the sense the oxidization and all will become more. Okay, so that's one aspect here. And since it increases the blood pressure, of course you will have to monitor the blood pressure. Fine. Okay, so dopamine, coming to dopamine also has got the same effect. And of course headache is one of the early symptom of drug excess. Okay, so and you need to monitor the blood pressure. Epinephrine, so epinephrine usually causes dizziness. Epinephrine when it is given, so dizziness is very common. So when clients are given with epinephrine, and always you need to check for the dose properly. Okay, and the client should be hydrated properly when epinephrine is actually administered. Fine. Okay, so they are the three important risks. Of course, we can hold on this isoproterenol. So this is not used very commonly in NCLEX. Okay, so whereas these three drugs are usually brought under the questions, you need to know these are the drugs that are usually used to mainly increase the heart rate. Coming to the next set, dopamine you learned. Let us also quickly review about dobutamine. Okay, so dobutamine is mainly it should be very cautiously used for clients who are having asthmatic problems. Okay, asthma and all. Fine, so that's very important. And of course, infusion pump itself has to be used there. Phenylephrine, when it is used, so basically check the blood pressure very importantly. So because you need to monitor, because since it increases the blood pressure, so monitoring is very important. Okay, yeah. So and also check for the IV site very frequently, because so it can cause extravasation. Phenylephrine can cause extravasation. Okay, yeah. Sodium nitroprusside, you need to know this. Some of the questions have got the sodium nitroprusside. So sodium nitroprusside, again, it is used for myocardial perfusion. In myocardial infarction and all, so we can actually use this. So sodium nitroprusside. Okay, yeah. And diphenhydramine, so usually antihistamines and all, so will cause drowsiness, giddiness. That is the very common side effect which you know. Okay, diphenhydramine, Benadryl and all come under the antihistamines category too. Fine. Okay, so now coming to the important points of these drugs, that is dobutamine, dopamine in together. So what are the main aspects you need to check? So you understand that these drugs, Miliron, sodium nitroprusside, phenylephrine, epinephrine, norepinephrine, dopamine, dobutamine. Okay, so are you clear with these medications? Norepinephrine, dopamine, epinephrine, phenylephrine, dobutamine, milirinon, sodium nitroprusside are the common drugs that are used to treat cardiac arrest, shock. Okay, so mainly cardiac arrest, shock, and for anaphylactic reactions. So these diphenhydramine, phenylephrine, and all are actually given. Okay, so and of course epinephrine also, you know. So in these cases, when these drugs are actually administered, you need to very importantly check for the vital signs, especially the blood pressure, urine output, check for extravasation, and also perfusion, whether the client is properly becoming perfused or not. Okay, so these are the common properties associated with these drugs. So is that clear? Okay, so yeah. So moving to the next category of drug, antacids. Of course, in the last class, in the GI disorders and all, we recently finished with antacids, isn't it? So now let us also focus some of the important aspects there. So under antacids, what kind of questions you can usually expect? Mainly aluminum hydroxide, calcium carbonate, they usually cause constipation. Okay, so when tetracyclines are given, so these aluminum compounds and magnesium compounds are usually not administered. Remember, okay, so these compounds are usually not administered. Okay, yeah. So then moving to the next aspect there, so you need to know that so these drugs can cause phosphate deficiency. So this is important. Okay, so phosphate deficiency can occur, and also malaise, weakness, tremors, bone pain are the other characteristic features. Okay, so under antacids, under aluminum hydroxide. Magnesium can cause diarrhea. Okay, so magnesium usually causes diarrhea, so just remember that. Fine. Okay, coming to antidysrhythmics. See here, I did not discuss any aspects under the H2 receptor antagonist and all. So we recently finished that, and nothing more will be asked on that. So you know, always H2 these drugs, antacids should be not be given with food. Okay, so there should always be gap for antacids, you know, those aspects, isn't it? So please remember that. And also let me focus on this point. This is also very important. So you need to check the client's sodium level, because sometimes the client can, if too many so this aluminum hydroxide compounds are given, the client can end up in hypernatremia. So it should be used in caution for clients with cardiac conditions and all. Okay, So they are the other points, the other important point under the aluminum hydroxide preparations. Okay, yeah. Coming to antidysrhythmics. See, antidysrhythmics in the sense they are the drugs that are usually used to correct the dysrhythmias, isn't it? So now when these drugs are usually given, so what all can happen? Like especially it will help in correcting the dysrhythmias, and of course at the same time sometimes it can also cause certain side effects. So it has been classified into different this one categories, but for us don't remember all those aspects. Remember some important ones, that is procainamide. These names you should know. Lidocaine, because under the options you will get those. Okay, so procainamide, lidocaine, fine. Tokianide, so something ending with IDE, so please remember that. Okay, and propanolol, LOL ending drugs, under which it comes, we studied under the cardiac system, those which the batch that has completed the cardiac system, or even others can say. So under which it comes, tell me, under which it comes, LOL ending
Beta blockers.
beta blockers.
Beta blockers.
Beta blockers, very good. Okay, so they are also used to correct dysrhythmias, in the sense especially when the clients are having atrial fibrillations and all, you know, so these beta blockers are of great help. So but very importantly, let me talk a few aspects regarding the same. Okay, so now here these procainamide and all normal, you need to check for the client will be on cardiac monitoring, so those aspects are very common here. So whereas especially when the client is on this propanolol, these kind of drugs, okay, so nadolol, propanolol, so mainly the client can experience hypotension, orthostatic hypotension, that is one thing, and also bronchoconstriction can happen. Okay, so please note down this point. Propanolol and all can actually cause bronchoconstriction, so this is very important. So therefore very cautiously it should be given in clients who are having asthmatic problems. Okay, so that's needed. So under the beta adrenergic blockers, you need to know that, right? Okay, yeah. So moving to the next aspect, amiodarone also is very important. So amiodarone, then this one, amiodarone come under the same antidysrhythmics. Okay, so it is also photophobic drugs, this amiodarone, ibutalar. Just remember this name, amiodarone. Then what about verapamil and diltiazem? So have we learned about this before specifically? So verapamil, diltiazem and all. So do you remember? So did we learn that anywhere?
Calcium
Under which
channel blockers.
calcium channel blockers, very good. Okay, so nifedipine, under nifedipine, amlodipine, verapamil, diltiazem. Okay, so what is the significance of verapamil and diltiazem? Any idea? Yes, mainly what is the side effect? It usually causes orthostatic hypotension. Okay, so you need to check for these aspects. So orthostatic precautions are very important. Okay, so verapamil, diltiazemide, and also under these calcium channel blockers, because it goes under the calcium channel blockers, and consuming grapefruit juice. Do you remember that we had explained, or you would have learned under the cardiac classes? Consuming grapefruit juice can lead to toxicity. Okay, so grapefruit juice usually is not given along with verapamil, diltiazem, and even other calcium channel blockers. And we learned that when if norepinephrine and all causes reflex bradycardia, so here, so these drugs can cause especially nifedipine and all can cause reflex tachycardia. Okay, so tachycardia can arise. Fine. So they are some of the drugs that are usually given. Let me just focus the names once again. Procainamide, please remember this. Lidocaine. Okay, so procainamide, lidocaine. So propanolol, amiodarone, verapamil. Okay, so these are the very important ones under the questions you will usually find. Okay, yeah. So moving to the next category of drugs. Next, I would like to discuss a few antibiotics as well as anti-infectives. In the sense both are same. Under these antibiotic categories, some of the important groups of drugs. Coming to aminoglycosides. Remember, these aminoglycosides examples are gentamicin, neomycin, streptomycin, tobramycin, amikacin. Okay, so amikacin is very commonly used. Gentamicin is also very common. They come under aminoglycoside. Okay, so usually it is generally these drugs are used for all the problems, all the infections. But the common, the very important side effect when aminoglycosides are used is ototoxicity and nephrotoxicity. Okay, so a client who is on gentamicin comes to report that he experiences tingling sensation or a ringing sensation. Okay, not tingling, a ringing sensation, tinnitus if he experiences, so or that indicates he could be having, he is experiencing the problem because of the drug that he is taking, and that should be notified immediately. So the clients who are on long-term use of these medications can end up having increased creatine levels. Okay, so because since this is nephrotoxic, monitoring for creatine levels are also very, very important. Is that clear? Okay, so please focus on these aspects. Yeah. And of course, in order to make sure that the kidneys are flushed properly, you need to encourage drinking lots of fluids. Okay, yeah. So that was about aminoglycoside. Remember the common drugs, gentamicin, amikacin. Okay, so they affect, like it will be causing ototoxicity or nephrotoxicity mainly. Okay, so that's the main common side effects. And nausea, vomiting, diarrhea and all, don't remember, because that is commonly experienced in almost all the drugs. Okay, yeah. So coming to the cephalosporin group of drugs, cephalosporin. Okay, so under this there are preparations in different generations. Like anyways, it will be cephalexin, cephalchlor, ceftriaxone, likewise. Okay, now even these medications are usually given for otitis media and all, and even some sexually transmitted infections, urinary tract infections and all. So this is commonly given. Okay, but so when these drugs are given, the chances of hypoprothrombinemia is very so the platelet counts, the clotting factors can go low here. Okay, the bleeding time can increase. In the sense, always you need to make sure that vitamin K is available. Okay, and also when a client is on these drugs, how do you get questions when a client is on cephalexin and all? So you need to encourage consumption of green leafy vegetables, because green leafy vegetables and all are high in vitamin K. So therefore, you can encourage, since there is a side effect of thrombocytopenia. So therefore, you need to encourage on these aspects. Okay, so is that clear? Yeah, and of course, no alcohol, no alcohol. Yeah. Coming to the next category of drugs, fluoroquinolones. Fluoroquinolones are usually used for urinary tract infections. Okay, so sinusitis and all. Now here, this can be nephrotoxic. This can be nephrotoxic. Okay, so check for elevated BUN. So SGOT, even SGPT and all are associated with the liver toxicity. So that needs to be checked. Okay, so that was the important point. Coming to vancomycin preparations, glycopeptides. Under glycopeptides, the main drug is vancomycin. So vancomycin is, so first time it is usually not given. So this is usually given when the client was previously infected, and then and when the client was not cured and reinfection occurs and all. So in those cases, usually vancomycin is administered. Okay, so this vancomycin is nephrotoxic, also ototoxic. Vancomycin is nephrotoxic, also ototoxic. This can cause extravasation. Okay, so this can cause extravasation. Care should be taken. And another side effect is it would be causing red man syndrome. Redman syndrome. Okay, so what is this Redman syndrome? So there is decreased, Redman syndrome is mainly when there is flushing of face and neck, especially in the back region and all, you will be finding rashes. Okay, so rashes are usually found, and that is something we can call it as a Redman syndrome. Rashes are usually found. Okay, and in the Redman syndrome, actually the component of this vancomycin will be causing the flushing, itching, and all. The body will be, in the sense, that is just a reaction to the drug. In that case, you will have to stop infusion and give antihistamine. And later you can start in a very slow dosage. Okay, that is Redman syndrome. Remember, so that is the main complication of vancomycin. Okay, yeah. Coming to the next category of drug, clindamycin. Clindamycin, usually clindamycin is very commonly given drug, isn't it? So whereas the main side effect you should remember is esophageal ulcer here. Okay, so very importantly, esophageal ulcer. So therefore it should always be given with, since the components usually cause or that is not easily movable, in the sense the constituents will be causing the ulceration, or that will destroy the layer of the esophagus, and therefore you need to make sure that the client is given with a full glass of water. You need to encourage plenty of water when these drugs are so when this is given. Okay, yeah, remember, esophageal ulcer is the main side effect associated with the clindamycin. Okay, yeah. The next category is macrolide preparation. Under this you get erythromycin, azithromycin, and all. So of course, erythromycin, azithromycin can be hepatotoxic. They can be hepatotoxic. Okay, so it should usually it can be taken in an empty stomach, usually recommended in an empty stomach, azithromycin preparations. Okay, so otherwise there should be a gap, like so after 3 hours of meal it has to be taken. So that's about the azithromycin. Penicillin preparations. See, penicillin is amoxicillin, ampicillin, so nafcillin. So they come under these category under the so the drug that is usually given for syphilis, mainly for syphilis. Okay, syphilis, the drug of choice for syphilis, the only effective drug for syphilis we can say as penicillin, or penicillin category drugs can be given, ampicillin, methicillin, and all. Okay, yeah. And of course, so when these drugs are given, so make sure that the client is given with good mouth care, because it will cause some metallic taste and discoloration. Good mouth care is very important. Okay, coming to the sulfonamide category of drugs. Sulfonamides are usually again very effective against infectious conditions that affect the gastrointestinal system, and also central nervous system. Okay, so it is an highly effective drug against this one, urinary tract infections, and also very importantly, and this can cause mainly peripheral neuropathy. The side effect, the very common side effect is peripheral neuropathy. Peripheral neuropathy, what would be the signs and symptoms? Any idea? What you should be checking in your clients for peripheral neuropathy? Neuropathy in the sense, what do you understand?
Numbness and tingling. Tingling and numbness.
Exactly.
Tingling
Okay.
and numbness.
Exactly, very good. So under this peripheral neuropathy, so what do you understand by this neuropathy? Neuropathy in the sense the nerves are getting damaged, isn't it? So how do you understand that? So you experience numbness and tingling sensation, especially at the tip of your nerves. Okay, in the sense in the hands and all, you experience a kind of weakness, numbness, and all. So that indicates peripheral neuropathy, so which could be caused because of sulfonamides. Okay, sulfonamide preparations. So that could be the side effect of the same. Okay, yeah. And of course, this is also taken in an empty stomach, and good amount of water, good mouth care is needed there. Tetracyclines are very much dangerous in pregnancy mainly, and it is also effective against usually all the sexually transmitted infections mainly. And even it is used for anthrax. Okay, H. pylori infection under combination drug it is used. Lyme disease and all this is used. Okay, so doxycycline, minocycline, tetracycline, so they come under the one category. So remember, penicillin is also used for syphilis and all. Penicillin, usually when penicillin is not that effective, the client can be changed to tetracycline preparation. Okay, but make sure that the client is not pregnant, because when tetracyclines are given during pregnancy, the fetus will be affected. It is teratogenic. Okay, so it's teratogenic. So that is an important point under tetracycline. And even when tetracyclines are taken, the client should not become pregnant. Okay, it is phototoxic reactions too. Fine. So yeah, and of course photophobia is a very common side effect of it. So photophobia, you should be advising about the effects of sunlight, and it should not be taken with antacids, of course we know, but not even with milk and iron preparations, remember. Okay, with antacids no drugs are usually taken, but this particular drug is usually not taken with milk and iron preparations also, so it will interfere. Okay, yeah. So, and after the expiry date, it can become highly nephrotoxic. And already I explained about the contraceptive measures, in the sense I told you it's best the client is not pregnant. If pregnant, so the client will have to so it is teratogenic. Okay, and suppose non-pregnant women, if they are on tetracycline, if they are taking oral contraceptives, it is best advised to use another method of contraception in addition to oral contraceptives. Okay, yeah. So overview of antibiotics, in the sense penicillins. So these are the preparations, and of course all these drugs, culture and sensitivity is very important. Okay, yeah. And sulfonamides category, so you need to know, yeah, there was one point also. So sulfonamides, usually vitamin C also should be avoided. Okay, so sulfonamide, because this is when it is given, so these under the sulfonamide category of drug, the urine can become acidic here, so that can further cause the urine so there could be some stone formations, crystallization and all. Okay, so therefore vitamin C is usually avoided with sulfonamides. Okay, yeah. So the other points we have already discussed, the main ones, only the main points. Okay, yeah. So under the ointments, I just want to focus on certain names of the ointments. That's it, not more here. So just you need to be familiar with the some name of the ointments: bacitracin, neosporin, povidone iodine. Okay, so silver sulfadiazepine, which is very commonly used for burns, silver sulfadiazepine, but this can be neutropenic. Please remember this. Okay, yeah. And Tolna flake cream. So Tolna flake cream, and also nystatin. Fine. So nystatin. So have you heard of this Tolna flake? Yes. Tolna flake. What is that? What's that? In which condition it is used? Flake. Tolna flake. Yes. In which condition? Any idea? Tolna flake. Yes. So usually for skin conditions it is used. Okay. So Tolna flake cream. It has got certain this thing like when so in rashes and all, when those cases and all, so they are generally helpful. Okay, so this Tolna, the composition is different, so that is just a brand name, the composition differs here. So it goes to chinactin kind of drugs. Okay, chinactin. So that is the composition that you need to know. Fine. So this is also an antibacterial. So under tinactin kind of, tinactin is the main preparation that is used here. Okay, so in this Tolna flake cream, so that is you need to know, right? Okay, yeah. So these are some important aspects. The NCLEX medications, so mainly focuses on bacitracin. So remember, so bacitracin, neosporin, and silver sulfadiazine. So usually it will cause neutropenia and all. Okay, so that's very important. So silver sulfadiazine and also the Tolna flake cream, nystatin cream, and all are the other ones that you need to know, right? Okay. Moving to anticholinergics. So what all did we discuss so far? So we discussed about antacids, so the cardiac drugs, isn't it? So then what did we discuss? Dysrhythmics, antidysrhythmics. Okay, so then what else?
Antibiotics.
Antibiotics, and also, yeah. So exactly, some ointments, the names of ointments. Okay, so because when they mention that bacitracin, neosporin, of course neosporin is very commonly used, but still silver sulfadiazepine in burns and all. So there are some questions I have seen, so where they had mentioned under the client education and all, the use of silver sulfadiazine. So if you are not aware of those creams, that generally the names and why it is the intended use and all, you know, so you can end up selecting the wrong options. So therefore, so you need to know these, and especially the cautions in many of the drugs so far, whatever we discussed, the drugs that are nephrotoxic. Okay, so the drugs that are hepatotoxic, the drugs that should be cautioned are bronchoconstriction, the drug that cause especially propranolol, the beta blockers, grapefruit toxicity drugs like the calcium channel blockers, diltiazem, okay, verapamil, the possible side effects of that, the drugs that cause hypotension. Okay, so you need to check for the blood pressure. So those orthostatic changes and all in which you have to monitor. So these all points indirectly will be assessed under the pharmacology. Okay, always remember, so that's why I'm focusing only the nursing action here, so nothing much. So the main side effect, whenever you learn drugs, you need to focus on the main side effect apart from the one that you know. Okay, especially vancomycin, so red man syndrome. If the client complains of rashes and all after giving vancomycin, okay, or then that indicates he's allergic to vancomycin. Immediately what you should do, you should stop and notify. Okay, so those kind of the questions you can get. So therefore, know the important side effects apart from the usual ones. Nausea, vomiting and all are the usual ones, you know. Apart from that, the specific side effects, okay, and the nursing interventions, what needs to be carried out. Okay, so that's very important, right? So now we get back. Name the drug. Let me just put a question to you. Which drug was causing, or in which drug you should basically focus on esophageal ulcer? Which drug mainly? Any answer? Yes?
Clindamycin.
Clindamycin. Okay,
Clindamycin.
so please don't forget. Like you may learn now, you may review it now, but still, the chances of forgetting is very high. You need to go through all these at least twice or thrice. Okay, yeah. Coming to the anticholinergics. Anticholinergics, of course, very common side effect is dry mouth, urinary retention, and all. Let us learn some of the names. Propantholin bromide, atropine, okay, belladonna, ipratropium. So where it is usually used, ipratropium and all, it's usually used as inhalers under inhalant drugs. Ipratropium, okay. So and these atropine, of course, you know that. So we had discussed about the same. So atropine before. So but these are all coming under the anticholinergic properties. Okay, yeah. So have you heard of belladonna? So why again belladonna, specifically in which conditions it is used? Belladonna. Yes, under what it is? What's that drug actually made of? Any idea? It is made of a plant. Okay, so that belladonna, so it's made of a plant, and this is also used for respiratory problems. Okay, yeah, and benzotropin, ipratropium, remember it's used as inhalers. Benzatropine, scopolamine, where is scopolamine used? Usually behind the ears as patches, scopolamine. Okay, so and it's also used for mainly vomiting and all, scopolamine, anticholinergic effect. So all these anticholinergic effects, mainly you should focus on dry mouth, urinary retention. Okay, so atropine, remember atropine, you know, like these anticholinergic drugs are contraindicated for glaucoma. So we had learned under the ENT disorders, isn't it? So you need to focus on these aspects, mydriatrics. Okay, yeah, scopolamine, ipratropium, atropine, propythalanthin, bromide. So these are the commonly used anticholinergic. Okay, yeah. So moving to the anticoagulants. So this is very important. Okay, we have discussed enough of anticoagulants earlier, but still let me focus on very important aspects of anticoagulants. So under anticoagulants, the common ones are heparin, warfarin, enoxaparin and all, isn't it? So enoxaparin, heparin, warfarin, and you need to learn the antidote for the same. Yes, we will come to this. Here, heparin, of course, the therapeutic value, as I already told you. So the therapeutic value is very important. Okay, 1.5 to 2.5 times the control than the control you can actually use. Somebody's mic is on. Okay, please mute. Thank you. Yeah. See, heparin mainly the APTT is usually checked. So it can be around 20 to 30 seconds. Okay, and 1.5 to 2.5 times up high, it can go as an this effect, like for the proper effect of the medication. Okay, so that is about the heparin. Coming to enoxaparin. So enoxaparin has got the same effect of that of the heparin, isn't it? So enoxaparin also has got the same effect. So we had, but it's costlier also. You need to know, fine. So it's costlier, and usually the half-life is around 4 hours. Okay, so 4 hours for a single dose. Usually the half-life stays for around 4 hours. So that is enoxaparin. Okay, yeah, and it's a bit costlier also. Warfarin. So warfarin, what is the antidote? Vitamin K. And what's the antidote for heparin? So that's protamine sulfate. This is important. Okay. So protamine sulfate, and for warfarin, it's vitamin K. We will discuss about these drugs in detail in cardiac system. So I'm just focusing only the main points here. So when anticoagulants are given, so what are things we need to focus? Mainly, you need to focus on the bleeding. Okay. So bleeding is very important there. So heparin, warfarin, if you are checking APTT, so what is the lab value you go in for warfarin? Mainly PT and INR. Okay, so PT and INR is usually assessed there. So both are different. Okay, so and heparin is given, warfarin is given usually as a maintenance dose. Okay, so warfarin is given usually as a maintenance dose. So so these are the common things, the very common aspects about these anticoagulants that you need to know. Fine. So let us learn a few herbal interactions also along with these drugs. So these drugs, especially when warfarin is taken, you know, so this garlic, ginger, ginkgo, like all these can increase bleeding. Okay. So therefore, so it should be before any herbal drugs are used. So it should be contacted. So the physician should be contacted, and then only you will have to use. Fine. Okay. So herbal interactions are very, very, very common. Fine. So that was about a few drugs. Anticonvulsants like I mean, so let me hold on this anticonvulsants. As of now, I'm holding this anticonvulsants. So we'll come back after 5 minutes. Okay, so I'm now going to give you a short break of 5 minutes, and after that, we'll get back to discuss the remaining aspects. Okay. Okay, guys, we'll continue with the remaining aspects. So hope you are back. Okay, so the next category of drug is drug in the sense under antibiotics, mainly there are two kinds, you know already, isn't it? So one is insulin rich, or the ones that are usually under insulins we consider, as well as the anti-diabetics, the oral, in the oral forms and all. Okay, so now insulin already, like I mean, so you are having next week, those who haven't completed, you have system class on endocrine disorders, and you will be learning there about the insulin in detail, its actions and all. So whereas as of now, so you can just remember these names. So rapid acting, short acting, intermediate acting, very long acting, those have already completed the diabetes mellitus classes. So you would be knowing about the significance of mixing the drugs, mixing the insulins and all, isn't it? It's the short acting, the long acting and all. I believe so. Others, since your topics are not yet covered, so you just remember these names: Lispro, Humulin, Isophane, Glargine. So they all come under the different insulin types. Okay. So, and it's very important to know the peak action time. The peak action time. Okay. You can get questions wherein they will ask you, when this drug is administered, at what time can you expect hypoglycemic action? So the peak effect of the drug, the time, for example, so if this action, if the when this drug is taken, so after the regular insulin is administered, so the peak action time is like 1 to 5 hours. Okay, so if the regular insulin is given at 9, so then you can expect the peak action by 12. Okay, so in the sense from 10 onwards the action will start, and it can stay up to 2. Okay, so up to 2, so it will stay 2 p.m. it will stay. So therefore the peak action could be around 12, 1, and also at that time the client can experience hypoglycemia. Those kind of questions you will get. So it's very important to learn the peak action, the total time, and also the name, the mixing of the drugs. Okay, which will be explained in the classes on I think next week, isn't it? So the endocrine system. So there you will be learning about these aspects. Okay, yeah. So coming to the other oral anti-diabetics, sulfonylureas. Don't get them confused with the terms sulfonamides and sulfonylureas. Sulfonamides come under the antibacterial properties. Sulfonylureas are the drugs that are given to treat so excess blood glucose level. Okay. So under sulfonylureas, glimepiride, glycipride, glipizide. So these are the drugs. And just remember the name, that's it. Metformin. So metformin, the main side effect is acidosis. Okay, so remember this, acidosis. So therefore, before any dye insertion procedure, if the client is on metformin, we generally stop the metformin because it will cause acidosis. Okay, lactic acidosis. Okay, the other names are miglitol. Remember this miglitol. Okay, so and yeah, this is okay. Thiazolidone, it's okay. Miglitoid and Prandin. So remember these names: miglitol, Prandin. Okay, so they are important. And sitagliptin also. Sitagliptin, gliptin property drugs. Okay, so let me get back to this: miglitol, sitagliptin, Prandin. So and glimepiride, metformin. Remember these drugs. Okay, so sulfonylureas have got many side effects, in the sense when sulfonylurea anti-diabetics are taken, so the client should totally avoid alcohol. Okay, so because it will be causing disulfiram like reaction. So are you aware about that? Disulfiram, what's that? Disulfiram reaction, what's that? Have you learned in psychiatry? Disulfiram.
Anti-alcohol.
Yes.
Anti-alcohol.
Yes, exactly. Anti-alcohol. This is used as an alcohol deterrent. Okay, those who want to, I mean, so the clients who are under de-addiction therapies and all, so they will be started with a disulfiram. This disulfiram, when the client is on this disulfiram, if they take alcohol, they will be experiencing worse reactions. Okay, so that's why. Fine. So disulfiram drugs. Yeah. Moving to the next one, biguanides. So biguanides, I already discussed metformin. Okay, yeah. So we'll move to the next category of drugs, which is that used to treat hypoglycemia, to raise the blood sugar levels. Any idea? To raise blood sugar levels.
Dextrose.
Dextrose.
And the hormone
Glucagon.
glucagon. Okay,
Glucagon.
glucagon. Very good. Fine. So glucagon is given. It can be given subcutaneous or iron. Fine. Okay. Antidiarrheals, like loperamide, isn't it? So Lomotil. So we discussed about the dosage and all. Bismuth salicylate. Okay, Bismol. So these are the commonly used antidiarrheals. Okay. So what's the maximum dose? Lomotil and all? 16, isn't it? Yeah. So forgot, we had discussed just before a week. Okay, so that's fine, no problem. I understand it's normal to forget, but please review. If you keep reviewing, you will not forget. Okay, yeah. So, and this bismuth salicylates, okay, they are salicylate preparations, you need to know. Fine. So salicylate preparations, and this maximum 2 days, not more than that, because it can end up in salicylate toxicity. So that's why. Okay, salicylate toxicity. So therefore, you should use it cautiously. Salicylate preparations. Fine. Okay. And this is also, I mean, so what we can say, this drug usually it doesn't get removed from the body very quickly. It has got dye-like property. So you need to encourage lots of fluids. Okay, so when this drug is taken. Fine. So antiemetics, the common ones are antiemetics, ondansetron. This is very commonly used. Okay, so chlorprazine. Okay, pazine. So these, remember these drugs, ondansetron, chlorprazine. Okay, so they are the commonly used, and also Reglan, promethazine. Reglan, of course, this has got anticholinergic property. Remember, anticholinergic property, it will be causing drowsiness. Usually antiemetics can cause drowsiness, remember. Okay, and certain drugs can also cause EPS, extrapyramidal symptoms. EPS is also very common, especially Reglan, when Reglan is taken. Okay, so therefore all the activity, the client should be continuously monitored for what we can say, whether the client is getting drowsy. So you should give this one sips of fluids. So that's important, because dry mouth is also another side effect of these antiemetics. Okay, under antiemetics, remember drowsiness, dizziness, even under skeletal muscle relaxants like baclofen and all, you know. So drowsiness, dizziness and all are very commonly common side effects on skeletal muscle relaxants also. Okay, so baclofen and also always when it is taken, you should be informing about its property of drowsiness. Okay, and the client safety should be the primary focus of a nurse. Okay, safety, remember safety whenever the client is on skeletal muscle relaxants as well as on these drugs, you know. So their safety should be the primary concern of a nurse. Okay, yeah. And since it is having anticholinergic property, it is avoided even for glaucoma, in glaucoma conditions. Okay, yeah, fine. So remember drowsiness, in brief, drowsiness, sedation, and this is very important. And also like, so there are some herbal interactions also, ginger and all can increase the risk of bleeding. Okay, so that's common for everything, but remember about the drowsiness, sedation, and safety. Antifungal drugs I brought in today's discussion because for the last NCLEX exam, antifungal drug was under the question. So remember the names: amphotericin, nystatin, fluconazole, metronidazole, Flagyl. We are used to call it as Flagyl, isn't it? So amphotericin. So usually you will have to refrigerate the medication. and hypokalemia. Check for hypokalemia. So this is very important. Okay, so amphotericin. So used for fungal, antifungal drug this is. Okay, hypokalemia is a very important side effect that you need to know. Okay, the question was on fluconazole for the last NCLEX exam. Fine. So what should be under the client education? What should be included? So that was the question, and the options were there were many aspects, but the answer was the sorry, it was yeah, the question was focused in such a way that which requires further education. Okay, so under that the option was I should take only sips of fluids. So that was the option, which was wrong actually, because fluconazole and all. So I mean, you need to make sure that you need to take a good water intake is important. Okay, so therefore that was the question. So sips of fluid should not be considered there. So that should be good water intake. Okay, so fluconazole. So remember, and and metrogyl preparations usually causes headache, metrogyl preparations. Okay, yeah. And also you need to check for the hepatic disease, CBC, LFTs and all should be monitored, right? Okay. Coming to the next one, anti-gout medication. So these three are the anti-gout medication: colchicine, probenecid, allopurinol. So you need to encourage good amount of water here. So specifically allopurinol, okay? Encourage fluids, because this urate crystals should be removed from the body. If uric acid, if urate crystals doesn't get removed from the body, I mean, so this allopurinol and all will I mean, so it will act in such a way that the uric acid formation is stopped. At the same time, whatever is formed also should be removed. So therefore, the encourage fluids are very important point here. Okay. Yeah, and acetyl salicylic acid preparations are usually not taken with allopurinol. Like aspirin and all are actually not taken with allopurinol. Okay, so please remember that aspirin and all. Right? Okay, and colchicine starch can cause peripheral neuritis. Peripheral neuritis. Okay, yeah. Coming to antihistamine, we discussed a few aspects before about the diphenhydramine, Benadryl, isn't it? So now, apart from that, chlorpheniramine, promethazine, cetirizine, all causes drowsiness. Drowsiness. Remember, okay? So, and usually these drugs are photophobic. Photophobic. Remember, in general, antihistamines are photophobic. Okay, caution to be taken when the client is out in the sunlight. Okay, yeah. Anti-lipemic drugs, so until that will reduce the cholesterol levels. Okay, bile acid sequestrants are one categories, statins are the another categories. Bile acid sequestrants and statins are the another categories. Under statins, it's very important to remember about myopathy. So this will be causing rhabdomyolysis. Rhabdomyo, M-Y-O it is, okay? L-Y-S-I-S, rhabdomyolysis. So a client who is on statins, so for a long time, atorvastatin, fluvastatin, rosustatin and all, can complain back pain, muscle pain and all. Okay, so that is the common side effect of statins that you need to know. Okay, yeah, so please remember these about statins, so you can get questions on the same statins. Okay, yeah, and also bile acid sequestrants will make sure that the cholesterol levels are decreased, cholestyramine, and it will bind to the bile and it will remove the bile, excess of bile through the feces. Okay, and thereby it will be decreasing the cholesterol levels also. Okay, yeah. But too much, it should not be used continuously. Fine. Statins and by this one, you please remember. And also niacin preparations will reduce the cholesterol levels. Okay, so niacin preparations. Fine. So bile acid sequestrants, statins and all come under anti-lipemic medications, the drugs that are usually used to reduce the cholesterol levels. Okay, yeah. Cardiac glycoside. What's the commonly used cardiac glycoside? Tell me.
Digoxin.
Digoxin. Very good. Okay, so digoxin.
Digoxin.
Yes. So digoxin, and when digoxin is there, like which electrolyte monitoring is very important? Digoxin, potassium. Remember this.
Potassium.
Potassium, okay, because low potassium can increase digitalis toxicity. Okay, so it's usually if potassium is the reason for digoxin toxicity, we give potassium to treat the toxic effects. Okay, apart from that, so this also you should remember, the drug, the antidote, digoxin immune fab, digibind, is used for the treatment of this one, toxicity. Greater than 2 nanogram is considered as toxic level. The therapeutic level, if it exceeds greater than 2, then that is considered as toxic. Okay, so then that is considered. And also the pulse or the heart rate should be, if it's getting reduced lesser than 60, so then you need to report it. In children, it should not go lesser than 90. Okay, so in children, so it should be around 90 to 110. So whereas in adults, if it's lesser than 60, you should hold digoxin. So digoxin is needed to improve or to bring about the cardiac contractility. It will help in cardiac contractility. It is coming under the positive ionotropic preparation. Okay, so it helps in bringing the cardiac contractility. So is that clear? Okay, yeah. So moving to the main two types of drugs we need to now learn, that is diuretics and antihypertensives. Diuretics is also a kind of antihypertensive. Mainly, there are three categories of diuretics. One is this one, furosemide and all. Okay, so loop diuretics, and apart from that, you are having thiazide diuretics. Okay, and also you have potassium sparing diuretics. Okay, so potassium sparing diuretics. See, these diuretics will be acting where? They would be acting on the nephrons. Okay, loop will be acting on the loop of Henle, and thiazide will be, or where do thiazide diuretic act? They will be acting on the early distal convoluted tubules. Okay, yeah. So now here, let us focus on these aspects. Thiazide diuretics first. The common names are hydrochlorothiazide. Okay, so chlorothiazide. So this is also called as hydrodiuryl also we call it as, chlorthalidone you call it as, metolazone we call. Okay, likewise hydrochlorothiazide, thiazide diuretics. Okay, so these these thiazide diuretics, since they work in the early, this one, distal convoluted tubule. Okay, so that is thiazide diuretics, and the side effects are hypokalemia. Remember, so this is very important. Even for Lasix and all hypokalemia, I want you to focus on this. Okay, so Lasix, please note these points. Hypokalemia but hyperglycemia. Here also hyperkalemia, hyperglycemia. Here also hyperkalemia, hyperglycemia. So even the Lasix and all. And it will make sure that, see, sometimes it can also cause hyponatremia. Hyponatremia. Okay. So please note on these points. And therefore, when the client is on these drugs, you should encourage potassium containing foods. Remember, potassium containing food should be encouraged even in furosemide. So even for digoxin, when a client is on digoxin, so remember these drugs. These points. Okay, yeah. So something regarding the and monitoring potassium is very, very important. Under loop diuretics, you find the Lasix and all. Remember, hypokalemia, hyponatremia, even hypocalcemia, whereas hyperglycemia are the common side effects associated with this. Okay, yeah, high potassium foods. So remember, high potassium foods, you can remember it as BP, DCNS. Okay, BP, bananas, potatoes, dried fruits, citrus fruits, nuts, spinach. Okay, so they are the high potassium foods. bananas, potatoes, dry fruits, citrus fruits, nuts, spinach. Okay, so they are high potassium foods. So is that clear? And especially when these diuretics, since they are hyperglycemic agent, the action of kidneys and all change to the cells. Here the mechanism varies. We are not going to discuss about the mechanism, especially here, since that's not that important. But remember, hyperglycemia, since hyperglycemia occurs, so you will have to very importantly monitor sugar levels in diabetic clients. In diabetic clients, always monitoring glucose is very important when the clients are on these diuretics. Okay, coming to the potassium sparing diuretics, see, potassium is retained. See, these diuretics, thiazide and loop, were acting on the nephrons, whereas potassium sparing act on aldosterone. And since it acts on aldosterone, so the instead of potassium, aldosterone's action is to remove potassium, whereas the potassium sparing like spironolactone and all will block the action of aldosterone, causing retaining potassium in the body. Usually when a client is on digoxin and all, the client will be on potassium sparing diuretics. Okay, so remember, hyperkalemia is the common, hyperkalemia and hyponatremia is the common side effect of potassium sparing. We have osmotic diuretics also that will cause dry mouth and all. Okay, yeah. So remember this point. Yeah, just I'll clear this off. Herbal interactions are again common here. So licorice, that's okay. Okay, so don't break your head too much. Coming to antihypertensives. See, under antihypertensives, there are ACE inhibitors, ARBs and all. Usually ACE inhibitors, so they block the action of this one, renin-angiotensin mechanism. Okay, we have learned in the cardiac system about the renin-angiotensin, which is required for converting, for raising the blood pressure level. When that renin-angiotensin action is blocked by these drugs, you know, so the blood pressure gets lowered. And pill-ending drugs are usually ACE inhibitors. Somebody's talking? Yeah. Pill-ending drugs are ACE inhibitors. Okay, so remember, pill-ending, PRIL. Now, so these drugs, what do they actually do? Any idea? So now the side effects are very important for you all. Like they actually block. So that is the action. Okay, but it can also cause dry, productive, non-productive cough, dry cough. Dry cough is usually the side effect of ACE. If dry cough is observed, so we will have to change to ARBs. Okay, yeah. And of course, mouth care, orthostatic changes can happen with these drugs. Okay, so with these ACE inhibitors, and also rashes, neutropenia, especially captopril can cause neutropenia. WBC count can go low and metallic taste in the mouth. Okay, and remember, when these drugs are started, you know, so when first dose is taken, usually it will cause blood pressure, low blood pressure. Okay, so in the sense it might lower the blood pressure, and orthostatic hypotension is very common in the first dose itself, so you should monitor for that. Okay, yeah. Moving to the atenolol, propranolol, they come under beta adrenergic blockers, as I had already told you before. So this LOL ending drugs. Okay, so you need to monitor for the heart rate regularly. Okay, and propranolol can cause migraine headache. Remember, propranolol can cause migraine headache. Okay, yeah. So again, calcium channel blockers, nifedipine, verapamil. Again, we finished discussing already about these aspects, isn't it? So they are the other set of antihypertensives also. So where grapefruit juice is avoided. Okay, so please remember this point under calcium channel blockers. Okay, yeah. So ACE, ARBs and all, you need to remember ARBs, sartan ending drugs, candesartan, aprosartan, losartan, valsartan. So they are sartan. The ending will be sartan. So I will be showing you the list of prefixes and suffixes of the drugs so that it will be easier for you. Okay, so these sartan ending drugs. Okay, so ARBs, under ARBs they come. Okay, sartan ending drugs, fine. So losartan and all. Okay, so whereas ACE ends with pril, ARBs ends with sartan, SAR, fine. Okay, and I had to explain one more point there under ACE inhibitors. I forgot about that. Let me just, yeah. So here, mainly under ACE inhibitors, you need to understand that. So this can increase the potassium level. Hyperkalemia can occur. Okay, please write down this point. Hyperkalemia. That's very important. See, other drugs, thiazide diuretics, loop diuretics, and were causing hypokalemia, whereas this causes hyperkalemia. Okay, so you should be monitoring for that. When a client is on ACE inhibitors, so monitoring the hyperkalemia is very important. Okay, yeah, this will cause hyperkalemia and hypoglycemia in diabetic patients. The opposite of diuretics. Remember, this is important. Okay, so questions can come based on this. So remember about captopril and all, they can, you need to monitor the potassium, not because of hypo, but because of hyperkalemia. Okay, yeah. So I hope you have written down those points. Fine. So yeah, that's okay. Alpha adrenergic blockers, clonidine, methyl dopa, they are certain names. Alpha adrenergic, prazosin, okay, clonidine, methyl dopa. So do remember these days. Alpha adrenergic blockers, okay. So beta adrenergic blockers are also there. So they all come under the this one. Antihypertensives. Okay, so they come under antihypertensives. So please remember. Okay, yeah. So moving to the next one, bronchodilators. Under bronchodilators, theophylline, aminophylline, terbutaline supply, ipratropium, albuterol, salmeterol. Okay, so these are the very important ones. Okay, yeah. So now albuterol, epinephrine, salmeterol and all, so they usually cause headache. That's a very common thing there. Okay, and especially theophylline drugs you should monitor for the, they all come under bronchodilators. You need to monitor for the therapeutic range. Okay, so the therapeutic range is narrow, so you will have to monitor for that. Okay, yeah, so that's it. Just to know the names of it. That's it. You need to check the vital signs also. Fine. Okay, so that's it about heavy metal antagonist. Heavy metal antagonist I'm going to discuss now. So this is important. Heavy metal in the sense when certain metals are toxic. So if you give these medications, they act as an antidote. Okay, for iron intoxication mainly, deferrexine, desferal is usually given. Okay, so deferrexine or desferal is usually given. For gold and other heavy metals, so dimercaprol or bal in oil. Okay, so this is usually given. Fine. Lead poisoning, EDTA. Remember, for lead poisoning, EDTA, you need to take seizure precautions specifically. EDTA. Dimercaprol for gold, mercury poisoning. Okay, and lead poisoning is usually corrected through EDTA. Let us focus on some of the opioids. Morphine, codeine, methadone, propacyclin, meperidine, hydromorphone, these are all oxycodone, they come under opioids. So what is the important aspect there? So you need to focus on the respiratory status. Okay, so respiratory infection, respiratory suppression. When hydrocodone is used, so you should not be used with MAO inhibitors. These MAO inhibitors are antidepressants. Okay, so it should not be used along with this hydrocodone. Fine. So it will bring changes in the cardiac rhythms and all, hydrocodone. Okay, yeah. So moving to hydromorphone. So make sure that usually the opioids antagonists are naloxone, naltrexone and all. Okay, naloxone, naltrexone. If it's overdose, you can give or you can correct with these medications. Naloxone, naltrexone and all. Okay. Codeine, these are all the names. Morphine, codeine, methadone, and usually methadone and all can cause dependence also. Okay, dependence. Yeah. NSAIDs, ibuprofen, indomethacin, naproxen, celecoxib. Ibuprofen should be very cautiously used with aspirin. Usually aspirin and NSAIDs are not used together because this can usually aspirin and these ibuprofen, indomethacins and all are usually not used together. So because they can cause bleeding. Okay, they can cause bleeding. So therefore, okay, yeah. So and celecoxib especially it is used in the sense again it's an NSAID. So whereas you need to, again, the same thing, it should not be used along with aspirin and other NSAIDs. Okay. Yeah. So psychiatric drugs, the next we are having a few important category of psychiatric drugs. Okay. So psychiatric drugs very commonly there are lots of psychiatric drugs. So I mean, so this could be very commonly, I mean, so those who have not completed psychiatry, it would be a little difficult for you. Okay, so psychiatric drugs, but still I want you to know the names of these psychiatric drugs especially. Okay, so now alprazolam, they come under anti-anxiety medications, AMD drugs. Alprazolam, Valium, lorazepam. Okay, so they come under anti-anxiety drugs. Remember, okay. So please remember this. And so these medications can cause CNS effects, depression, anti-retrograde amnesia. Remember, okay. So anti-retrograde amnesia. So driving, hazardous activity, everything should be avoided here. So when anti-anxiety agents are usually taken. Buspirone is an anti-anxiety or anxiolytic one wherein you don't become dependent on it. So dependency is very common in these drugs, whereas buspirone usually dependency is unlikely. Okay, so buspirone. But buspirone should not be used again with monoamino oxidase inhibitors. That is another set of antidepressants. Okay, see, under antidepressants, we are having SSRIs, selective serotonin reuptake antidepressants, atypical antidepressants, tricyclic antidepressants, and monoamino oxidase inhibitors. Okay, these are the main 4 categories. Remember these names: paroxetine, sertraline, excitrop. These are all used in the NCLEX exams. Psychiatric drugs are very important. I believe in psychiatric classes, the medications would be taken in detail. Okay, like so paroxetine here. I just like to review for those whom already the psychiatric classes are over. So I just want to review for you. That's it. Okay, so those who are yet, those psychiatric classes are not over, so it would be difficult for you to comprehend every aspects. I do understand, but still try to get something through this class so that you can apply it when the actual sessions are taken. Okay, so paroxetine, sertraline, escitalopram, fluoxetine. Remember these 4 names under SSRIs. SSRIs usually they make sure that the serotonin is an hormone that is required for increase in the mood and all. So after the hormones, I mean, so after the increase, so these hormones will be, I mean, so it gets disappeared, it gets dissolved, or it gets reuptake. So this reuptaking is prevented by these medicines so that the hormone stays and thus the mood gets elevated. Okay. So, and this should be cautiously used, especially paroxetine is contraindicated with MAOIs or tricyclic antidepressants. And this serotonin can cause, when the dose increases, it can cause serotonin syndrome, we call, where the client will be having fever, confusion, hallucinations, and all those side effects. You should be monitoring for that. Okay. So remember about, and usually SSRIs are not used together with monoamino oxidase inhibitors. Please note this point. They are not used together. Okay, MAOIs are usually, and also tricyclic antidepressants generally are not brought together with these drugs. Okay, yeah, and And specifically, this can also cause sleep problems. These drugs, SSRIs, can usually cause sleep problems. Okay, yeah. And coming to the antidepressant bupropion. So this will cause again dry mouth and all, anticholinergic effect. Remember that. Okay, yeah. Then doloxetine, mirtazapine, reboxetine, they come under atypical antidepressants. So this can reduce the sodium level in the body. Okay, sodium level. So you should be monitoring for that, hyponatremia. Okay, yeah. So amitriptyline, they are other important drugs. Amitriptyline, imipramide, nortriptyline. So these names are usually asked, okay, or they are brought in the questions, amitriptyline and all. So now, so this usually you need to consider that like this can cause orthostatic hypotension. Okay, so monitor for this orthostatic hypotension. Okay, and this also has got an anticholinergic effect. Remember that orthostatic hypotension, anticholinergic effect. Okay, yeah. Monoamine oxidase inhibitors are the last category of antidepressants which are used because they usually have lots of side effects. Monoamine oxidase inhibitors. With SSRIs, this is not taken at all. Remember, okay, with SSRIs, usually monoamine oxidase inhibitors are not taken. There should be a good gap before these drugs are started. Like suppose if the client is on SSRIs, only after 2 weeks time and all we can start with, after these drugs are slowly removed from the body and also you can start with monoamine oxidase inhibitors. Okay, so that's important. Fine. Okay, monoamine oxidase inhibitors usually when a client is on monoamino oxidase inhibitors, tyramine-rich food should be avoided. So tyramine, remember, tyramine-rich food should be avoided. So you can expect questions based on that. So do you know what is tyramine, in which it is present? Tyramine is usually present in baked foods and all. Okay, so this is basically this tyramine is responsible for increasing the blood pressure in our body. Dietary tyramine. Okay, baked foods and all usually consist of tyramine. Okay, so yeast, sausages and all will consist of tyramine. So this tyramine usually increases the blood pressure in our body, but when it is taken with MAOI, it can cause hypertensive crisis. The effect can be very, very high. Okay, so therefore, so tyramine rich foods are usually avoided here. So remember, okay, so along with monoamino oxidase inhibitors. Just clear this off. Fine. Okay, remember about these things. Fine. Okay, monoamino oxidase usually contraindicated even with Parkinson's, anti-Parkinson's, levodopa medications also, levodopa, carbidopa also. Okay, yeah. Mood stabilizers are commonly used. Lithium carbonate. Lithium toxicity you should monitor. Remember, if it is about 2.5, the toxicity is very high. It indicates that the toxicity is very high. Okay, so if it is greater than 2.5, so lithium can be toxic. It should be lesser than 1.5. So this normal level you should remember, it should be lesser than 1.5. Greater than 2.5 is extremely toxic. Okay, yeah, so toxicity. So remember, okay, now here so when the toxicity increases, the client will be having polyuria, tinnitus. Remember this, polyuria, hypotension, tinnitus. These three important signs and symptoms you should remember. Polyuria, tinnitus, hypotension. Okay, the initial indications of toxicity are GI problems. GI problems, polyuria will begin, but severe toxicity will be indicated as severe polyuria. Okay, yeah, so lithium. For lithium, the potassium and sodium level should be normal. If these two are not normal, the lithium can become easily toxic. Okay, so potassium and sodium level should be normal, especially sodium, remember, otherwise it can become easily toxic. So when a client is on lithium, you should monitor mainly for electrolytes, remember this point. Okay, so that's very important. So again, we have some anticonvulsants, carbamazepine, valproic acid, carbamazepine, valproic acid. Okay, so carbamazepine and all anticonvulsants, and you need to monitor for sodium. Remember, always anticonvulsants, you should monitor for sodium. Here for carbamazepine also, grapefruit juice is contraindicated. Carbamazepine, grapefruit juice is contraindicated. Okay, valproic acid, hepatotoxic. It's hepatotoxic. You need to monitor for the liver problems. Okay, yeah, and carbamazepine usually can cause Stevens-Johnson syndrome. So that is wherein you get rashes and all on the body. Okay, so Stevens-Johnson syndrome also can arise here. So with the carbamazepine, fine. So if the as a side effect, so that's also needed, right? Okay, so these are some important drugs under the psychiatry also, so that you need to remember. Okay, so is that clear? See, again, like so the main points we have discussed, and there could be some herbal interactions in all of these drugs, so you need to know. Fine. So now these were some of the important drugs I had to focus in today's session. So now let me also talk about a few. So I think it's there already in in your resources portal. Some of the prefixes and suffixes of these drugs. So if not, so this will be, I told you, like by next week, this pharma resource will be, the slides will be uploaded in your learning portal, and you can just write down. Okay, so that this will be easy. The prefixes and suffix, I think it's already there. So have you checked? It's there, right? So has anyone noticed the prefixes and suffixes of drugs for your easy reference? Nobody noticed? Okay, so we'll check it once again. I'm not very sure about it. I'm not 100% sure because I was thinking it's already there. So we need to check it because it was already it was framed long time before. So I need to check it once again. Okay, yeah. But anyways, by next week, once you get these slides, it will be easier for you. Okay, I'm not going to explain about all these aspects because these are readable ones. So prefixes are there. So the class is there and some examples are there here. Okay, similarly here, prefixes, the suffixes, they are the suffixes. Okay, dipin, dazole, silin, calci, ending drugs, you need to know. They will usually under what categories it will come. Okay, so just that is for your, that will help for your easy understanding, I hope so. All pre-lending drugs, whichever I explain, the same things are here. I'm just showing this just to make sure that you learn through these slides. Okay, so that's it. Zolam, so just somewhere it can be helpful to you all, I hope so. Therapeutic levels, please note down these therapeutic level. Digoxin 0.8 to 2, lithium 0.8 to 1.2, 1.5, I said, right? 1 point lesser than 1.5 is considered as toxic. Theophylline 10 to 20. Phenytoin, anticonvulsant, it is 10 to 20 again. Vancomycin 10 to 20 again. Salicylates 150 to 300. Carbamazepines 5 to 12. Gentamicin 5 to 10. Phenobarbital 10 to 30. Procainamide. So when you see now procainamide, tell me under what it comes. Quickly, who is going to answer? Procainamide. I don't want you to turn pages. Yes.
Cardiac.
Cardiac. Cardiac what? Libby. Cardiac. dysrhythmics, isn't it? Yeah. Amitriptyline,
Depressant.
depressant. Yes. Okay. Yeah.
PCA.
Fine. So, yes, exactly. So these are some aspects you had to know under the medications. Okay. So any doubts for clarification? See that there are lots more drugs, like I mean when sessions are taken, like as I told you, I haven't brought in here muscle relaxants because mainly musculoskeletal muscle relaxants and all baclofen safety I already told you. I haven't brought here some of the steroids and all, so because you know, like usually when steroids are given, hyperglycemia, like osteoporosis and all are the common side effects of giving steroids. So those are specific to the conditions. Okay. And that's why I have not brought in the discussion, and the thyroid hormones and all I have not brought under the discussion. So you will be learning it separately in the sessions also. So here in this session was to focus mainly on the basic aspects of medicine administration and also some important points associated with each drugs, and to be familiar with the common drug names that are usually brought in the exams. So these are the common drugs names that are usually brought under the scenarios as well as in the options. Okay, so just review all these aspects. So is that clear? Yeah. So any questions, or else we can wind up the session. Okay. So yeah. Okay then. So that's all about today's session. And thank you for your time. So because this was today was actually not your session day, but still you are there. Thank you for that. Okay. So see you next week. Take care. Bye.